Hey everyone, Larry Wynn, CEO of Summit Imaging here, and we got our special guest.
Hi, I'm Carolyn Coffin. I'm an ultrasound educator and an ergonomist with Sound Ergonomics, and I also work with Larry and his team on various transducer issues.
So we just want to make a little video about what we're doing in the market, and really working closely with Carolyn. With our objective is to really bring the clinical engineering side of healthcare closer to the sonographers, because what we're learning together is, number one, there's a communication gap sometimes, and we want to close that down. But number two, if we do educate with these two audiences in mind, which both impact patient care, and they both impact the longevity of the equipment in use, Carolyn has been writing a series of white papers on what she's observing and what we can do together to help sonographers and help the equipment.
Exactly.
So tell us about your next paper.
Well, the paper that we did initially was to look at transducers that were repaired with OEM components versus transducers that were repaired with counterfeit components. And using a scanning phantom, we looked at different image quality parameters and really found that the quality of the image with OEM repaired transducers was much better than the quality of the images with the transducers repaired with counterfeit parts. That really enhances the quality of the patient care. So you have reproducible images that are at the highest quality possible, and the sonographers have diagnostic quality images that hasn't cost them a lot of time and scanning, potentially scanning injury components to produce. So I think it's important that sonographers and managers understand the value of appropriately repaired transducers using OEM parts and following rigid specs.
I think the details of that white paper was really aimed at counterfeit crystals versus OEM crystals and transducers, because that is really the bedrock of the image performance capability of the equipment that sonographers are using.
Yes.
But then I think you have another white paper that you're writing about, which is if you're using inferior components that are counterfeit crystals, where the image quality is degraded, and how it can strain the sonographer now and impact your workflow.
Yes, now we enter the area of ergonomics, and there's a very high percentage of occupational injury among sonographers, and increasing transducer time, or the length of time you're holding the transducer, increases injury risk. Transducers repaired with counterfeit crystals will have degraded images, and the sonographers are struggling to improve those images, having to repeat certain views or constantly trying to correct for the poor quality. That increases their transducer time and increases their risk for injury. So it's important that everybody's aware of how the appropriately repaired transducers using OEM parts really does affect the sonographer's work and their comfort level.
So sonographers, if you're suspicious of these images not looking quite right, and you're struggling with your images, you really should be looking at your equipment, because there is equipment out there that is inferior, and we're here to work together to bring that education to you so you're aware, and maybe you can make some adjustments to make sure you have the right equipment to do your jobs as efficiently as possible.
And as sonographers, you not only need to be aware of the equipment you're using, but how it's maintained and who's maintaining it.
So that's another series of videos, so be on the lookout for that on our YouTube channel. We're actually going to do a series of videos for handling and care, and the things that we're learning with our big healthcare facility customers on what we can do to improve together to elongate the life of this really critical equipment that impacts everybody.
Yep,
so
that's true.
Well, thank you so much, Carolyn. We're coming to you from Colorado out here, so keep an eye on our YouTube channel, and we'll talk to you soon. Thanks for watching.
Thanks.
Bye.
Bye-bye.